All righty. Well, good afternoon, everyone. We just wanted to give you a big welcome to another week of Roswell Park's Ask the Wow, I completely messed that one up. Ask the Experts webinar series. It's Friday. That's why my mind must be a little bit jumbled here. I'm Rebecca Voda. I'm the Media Relations Specialist at Roswell Park Comprehensive Cancer Center in Buffalo, New York. For those of you who are joining us for the first time, welcome. We are so happy to have you here. We hope you find this series and all the other episodes we've had to come both informative and helpful. For those of you who are returning, we are so very glad to have you back, and we will be sure to address a couple of new questions today. Now, last week we discussed a wonderful topic, and that was advice for cancer caregivers. That full video is available for on-demand viewing on both our Facebook page and our YouTube channel, and also on the landing page for all of these webinars, which is roswellpark.org/patient-webinars. Today, very excited to bring you a brand new and exciting discussion on mindfulness meditation. And we are very fortunate to be joined by Joe DiNardo, Esquire, author of Mindfulness Matters. Now, a little bit of background first, and I'll let him kind of take the reins and tell a little bit about himself in just a second. But just to let everyone know, he's a local attorney, and he has served as a caregiver for his wife, Marcia, during her cancer diagnosis and treatment at Roswell Park. He found that mindfulness meditation practice helped him through the difficult challenges of caregiving and also grief. He has studied and practiced Vipassana, which is insight meditation in India and also in Asia, and has also served as a teacher and inspirational speaker across the country. Joe, we are so very thankful to have you with us today. First, can you just tell us a little bit about your background on mindfulness and then also your involvement with Roswell Park?
Okay, and is my mic on? Great. Thank you very much for having me. I appreciate it very much. So going back to the late 60s and 70s, it was a very raucous time in the United States with the war raging and college campuses on fire, including the University of Buffalo. But I stumbled upon Buddhist meditation practice around 1968 or 9, and started reading about it. It caught my attention. I found it very inspiring, and the idea of learning to focus your attention and bring the mind under some control made just a lot of sense to me because of my background and things that had occurred in my childhood. So I started the practice then. I took to it very seriously. Starting in 1972, I began to set 1 week and 2 week retreats. One of my early teachers was Joseph Goldstein, who has spoken at Roswell, and Sharon Salzberg, who has spoken at Roswell as well. And then in about 1980 or 82, I met my teacher, Anagarika Munindra, a delightful little Bengali who was highly known in the Buddhist community. And he was very helpful in the practice as well for me. So I was married in 1999. My daughter was born in 2000. Life seemed pretty good. I've been practicing law for quite some time. And then in 2005, I suffered what they call a thunderclap headache, and thinking that it was only a migraine. I was in enormous pain at the hospital. They took me to the hospital. But it turns out that I actually had a very large tumor on the right side of my head. And that, of course, required surgery for multiple reasons, especially because of where it spiraled down to in the base of my skull. And so I was confronted for the very first time with my own mortality. And I can talk about that later if we like. But that was a very, very experience, a very enlightening experience and a very confirming experience about the strength of my practice. Then in 2013, my wife was diagnosed with stage 4 pancreatic cancer, completely out of the blue, never sick, healthy, beautiful. The diagnosis, of course, just took us off our feet. And for 2 years, she battled it, with various stents of chemotherapy and radiation and all the different things that people at Roswell, suffer with. And again, I found that my practice was real support for me in helping me just let go of a lot of the sadness and a lot of the grief and a lot of the stress of what was occurring in my life and with my wife. And again, it confirmed for me, putting aside just for a second, the very normal grief and sadness I did experience and continue to deal with. But mindfulness practice gives you a tool to deal with those things. It's a helpful, strengthening tool to have, and I found it quite fulfilling for me. So sometime after that, I wrote a little memoir called A Letter to My Wife, based on an actual letter I was writing her at the time of her death. And someone at Roswell saw that and said, gee, we didn't know that you were mindfulness and that you've taught some time. Would you be willing to come to Roswell and teach meditation, which I've been doing there for about 3 years, both to patients and to staff. And we've continued with that mindfulness, and we're trying to work that into the Roswell overall wellness program in a much more formal way. There have been great people at Roswell doing that work, and I've stayed in touch with it. So that's how I've been involved with Roswell for a couple of decades, but became more involved during the 2 years that I spent on, a lot of days and nights at Roswell with my wife and with the staff and her wonderful oncologist, Dr. Ranuka Iyer, who is my ocean of compassion, I call it.
Thank you so much for sharing all of that. And I'm sure we'll be able to get into more as we start to shift into the question. But I mean, one of the reasons we decided to have this webinar is because mindfulness is just one of those terms that has grown in popularity, over the last few years, but there's still a lot of us who don't know exactly what it is or, how to do it, especially during, this pandemic that we're going through right now. It is so important to take time out, if you have the chance to take time out, and learn new tools and also coping techniques as we navigate our stress and anxiety. And now today we do hope that Joe is able to provide you with some valuable insights. We are hoping that we can get as much advice out to you as possible within the time allotted, right until about 12:30. So while we have several pre-submitted questions, there is the option, of course, down below where you can access the chat feature to send your questions to us. Please make sure that when you do send questions, send it to just the panelists, or you can even check mark the box anonymous if you do not wish to have your name associated with your question. That'll being said, Joe, I think we can get started with really just the top question. I mean, what is mindfulness, and is it different than meditation?
Well, I've been teaching for some time, and it's a great question, and I'm still trying to figure out how to answer it. So let me simply start by saying that the words that we choose to explain our inner and personal experiences, are words that we choose that work best for us. And as a result, when we're talking about our inner world, all of us, not just me, it's very difficult to pick the right words to use all the time. But in any event, mindfulness, the way I'm using it in the practice that I have, is a special kind of awakeness, alertness, and awareness of what is happening moment to moment. We hear that phrase all the time, but we don't know how to do it. I mean, so we said, I want to be in the moment. But the reality is we often just lack a tool or a blueprint on how to do it. Learning to be mindful takes effort, commitment. It's not for the faint of heart. But for all of us who, have experienced so much difficulty, especially the Roswell family in general, where so many people are suffering as a result of cancer and the treatment that goes with it. you know, a lot of the old paradigms of how we deal with those kinds of things just don't work. And so a tool like mindfulness, I think, could give people that opportunity to more effectively deal with stress, with anxiety, with fear, and a lot of other thoughts and emotions. But it takes effort to do it. And but mindfulness, let me give you an example of what I mean by mindfulness, as opposed to just being aware of something. My friend Joseph Goldstein used this example, which I thought it was great. If you have a Labrador Retriever and you have a Frisbee or a stick, you show it to him or her and you throw it, they're like attentive on that stick, and their attention doesn't waver. They race wherever it goes, they pick it up, they bring it back, and they sit there waiting and staring at it for you to throw it again. They are in the moment. That dog is in the moment. But I don't think any of us would say that they're being mindful. Mindfulness means not just being in the moment, but to be aware of the fact that you're in the moment. So it can be defined in many different ways, but in the tradition that I'm trained in, mindfulness also carries with it an ethical component. And by that I mean not religious. By that I mean that mindfulness has two pillars to it. One is concentration, which allows you to cultivate wisdom and to see things as they are, that they are rising and passing away moment to moment. And there's nothing we can do about it. But the other pillar of mindfulness is compassion. And in the West, we haven't spent so much time recognizing that compassion is an equal partner in mindfulness overall. So while we're also cultivating wisdom, we're also cultivating loving kindness or compassion for ourselves primarily. We're learning to stop self-judgment, self-criticism, learning to love ourselves, and then from there, expand it out to our family and friends, to strangers, and even to people that we have difficulty with.
You mentioned a lot of, mental benefits to all of this. You're talking about the compassion and whatnot. Does mindfulness have any sort of physical benefits for anyone who decides to practice it?
But it would be difficult here to like give you the list of all the studies that have been done. In my book on Mindfulness Matters, I list a lot of those things. But the simple answer is yes. They have found that mindfulness can help reduce the experience of pain, especially chronic pain. It has been helpful in psychotherapy, and I'm in no way saying that it's a replacement for any medical treatment. It's not. It's not going to cure you of anything. But it changes and can change your relationship to the fear, to the anxiety, and to your preconceived notions about what things are and how you're doing, which often just adds layers of additional pain and tightness in the body. So it has been very helpful to people who have chronic migraines. But yes, the answer is yes, it has a lot of help with physical problems.
Now, I'm sure a lot of people, they want to know how to incorporate this into everyday life. If we had to really go down to like the, once a day sort of thing, I want to try to incorporate it like either if I'm at work or on my lunch or that sort of thing. Like, is there any way you can kind of like guide us through something, so simple as like if someone is able to carve out that small amount of time?
Okay. So again, remembering that there are these two pillars to mindfulness practice. What I would suggest is on the concentration side, that we learn to, by practicing, learn to sit quietly, comfortably, trying not to move, paying attention to one object, preferably something like the breath. We always have the breath. Everybody has the breath. It's always with us. If we don't have it, we don't have to worry about mindfulness. Okay, so it's always there. And so if we use it as a object of concentration, focusing on the in and the out of the breath, and watching thoughts arise and pass away, emotions arising and passing away, streams of consciousness arising and passing away. We can begin to see the different patterns that block us from directly experiencing some of the beautiful things that are out there to experience in the world, because we have all these preconceived notions of what they are, what they must be, how we're supposed to relate to them. So mindfulness is very simple. It's just letting go. It's letting go. But the other part of the practice, that is, each time you're sitting, you're following your breath, you will find out in about 3 seconds that your mind doesn't want us to do that. A thought will come. What am I doing? Oh my God, I didn't call Nancy yet. I gotta get to the office, and et cetera. Everything comes up. Each time in the practice that you catch yourself drifting off with a thought, whether it's in 2 seconds or 2 minutes or 20 minutes, at some point you'll say, oh my God, I'm not following my breath. At that instant, we have to practice non-judgment of ourselves. Instead of saying, you're doing this wrong, you don't know what you're doing, you're no good at this thing, whatever it might be, make no judgment at all. Make an effort to lovingly seeing that you drifted away, and just without judgment, without comment, come back to the breath. That's the practice, the learning of non-judgment and compassion for ourselves. And over a period of time, you begin to grow a sense of humility. You see just how human you are. You begin to recognize everybody's doing the same thing and struggling with the same things that we are. And it becomes we become, I think, more humble as we develop our practice, because we begin to see how human we are.
Now, you talked a little bit about you being, a caregiver for your wife and incorporating the practice as being a caregiver. But what about for the cancer patient themselves? You just touched upon, not judging yourself for being so worried about things. But cancer patients, I'm sure, are inherently worried about things that are happening in their lives with their treatment, etc. So, is there a sort of a best way to, introduce this to the cancer patient? Is mindfulness going to work for a cancer patient?
I think so, yes. And the answer to that is, again, this is not a panacea for the suffering or for the physical ailment that the patient is dealing with. But the word you used was interesting. You said the worry. And that's where the mindfulness can be helpful, because when our minds are out of control, we're dealing with our own mortality. We're dealing with physical suffering because of whatever disease we might have. We're dealing with the suffering that comes from the treatment of the disease, which can be devastating. If we can learn on our own to sit back and be quiet and follow the breath, even though we're struggling with all those things, and let those things just be there, but don't enhance them with worry. Don't enhance them with our fears. Just trying to train yourself to be in the moment and let those things be.
Now, we do see a question coming in regards to passing along some thoughts about techniques about mindfulness for children. Now, I know that kids, I'm sure their minds are running a mile a minute and that sort of thing, but I mean, is there any sort of best practice to introduce this concept to our younger folk?
Great question. Wow. Uh, so again, the answer is, and there's a lot of literature out there about school systems and places where they're doing this for children. Okay, and of course, obviously, you can't, train a child in mindfulness the way we're talking about it here. We have to sort of bring it down to the level that they understand. But children will respond to the whole group sitting and just trying to pay attention. They sometimes think it's fun, closing their eyes and just feeling their bodies and trying to concentrate their minds. So the answer is, just doing that for 5 minutes a day for a child is a big deal. Okay, and if they stay with it, it's hard to imagine, the overall benefits that they can develop and deepen their practice as they grow up. But it can be, I think, just like they find when they take kids who have lots of extra energy, ADD, whatever, ADHD, and they put them into yoga disciplines, or they put them into karate disciplines, and they find that they respond very well like that. They need some structure like that. So yes, I think it's very helpful and a great idea to share it with your children.
Fantastic. Thank you for that. This is kind of an interesting one we had sort of pop through, but, sort of there could be some skepticism around this, some wariness to try new things. I mean, it's worth asking. I'm sure some people, it seems like every day there's a scam out there, someone trying to get someone, etc. I mean, is mindfulness a scam? I mean, I'm sure it's worth answering.
Well, again, mindfulness is now used by everybody for everything. So I would say to you, I'm sure there are scams out there of people who read a book, they're gifted speakers, and the next thing you know, they're teaching mindfulness. So I would be skeptical of that. The tradition in Buddhism in general, the teachings are offered for free. Most teachers that I know around the world don't expect, and they never are paid to come and teach, whether they're for an hour or a week or a month. They are often, how they live then. There is a thing in the Buddhist practice called dana, which means giving. And the students learn over time that if they want to give to the teacher anything, they can do it. But no one is required to do it. And I think this criteria is, if you find a teacher and the first thing they start talking about is how much you're going to pay them, I would be skeptical of that, because the teachings should be for free. Now, there may be costs of like rooms and meals. It depends on what's happening. But I think that the teachers that I respect the most don't get paid for teaching the Dharma, the practice.
That does kind of lead us into another question by someone saying that they've seen mindfulness classes that cost a lot, and said person who submitted a question may not make a whole lot of money. I mean, what sort of options are out there for individuals who maybe can't afford a retreat or what have you?
Starting right here with us, and anybody who's listening to this, I have been offering mindfulness training on Thursdays at noon at Roswell. Now, obviously, we're not doing it now, but when when we're allowed to start that again, we'll be offering it at Roswell, and it's for free. Over and above that, there's an organization called the Mindfulness Alliance in Western New York. They're the ones who put on the all-day mindfulness festival last fall. Sharon Salzberg came in to speak. They had 1,800 people, I think, maybe 1,200 people that came. Okay, they charged a total of $10 per person. So, and they gave lunch. I mean, it was done whatever it cost them to do it, that's what they tried to raise. So I would look into the Mindfulness Alliance. They're here in Western New York. If you're very interested, where you want to go and sit at a retreat, which I would highly recommend, I would start with the Insight Meditation Center in Barre, Massachusetts. That's where I started, and I practiced there for almost 50 years. And it has turned into and evolved into a world-renowned meditation center. And if you don't have the money to pay for the room and board, they have, they will do it for free. They have, so the answer is anybody can go, and it doesn't have to cost you money that you can't afford.
So there are options out there. I mean, it's for, yeah. I mean, if you want to get started, you can get started right after we're done with this chat. I mean, it's that simple.
I mean, I would say first, I think it's good to read a little, okay? I think that if you want to start a meditation practice, you need to have a chat with yourself, because I think a lot of people say they want to meditate, but what they really mean is they want to meditate. Because if they wanted to meditate, they'd be doing it, okay? So have a chat with yourself and ask yourself, do I really want to do this? Do I want to explore this and be adventurous? And set aside, just for a little bit, any preconceived notions I have. Because mindfulness, for the practice, for you to cultivate the practice, you just have to come to it and let things, whatever comes up in the mind, whatever it is, we're just watching. It's an adventure in self-exploration. And as you develop that tool, you begin to look more deeply into how you actually are functioning in the moment. And then the other half of it is compassion. And we actually have a special, there are actually special practices on compassion. Maybe we can do that today for a few moments. In mindfulness that people can do every day. And it can be very helpful in learning to love yourself, and then to, by steps, move that compassion out.
So you talk about having a conversation with yourself, and also, taking some time out to read. But, just one sort of last question I do want to throw out there is, what if there really is no time? I mean, I'm seeing a question come through of being a mother of 3, a caregiver for her husband, and working full time, don't have any time to meditate. What any advice to pass along there?
Wait a minute. This is one person that has all of that. That's a lot. That's a lot. All right. So mindfulness meditation isn't about just sitting on a pillow. Okay. You can be mindful driving your car. You can be mindful doing the laundry. You can be mindful putting breakfast or dinner on the table, both parents. And but it's very difficult to be mindful in the minute way that you might do when you're sitting. But you can have a sense of mindfulness where you're brushing your teeth. How about this? Just brush your teeth. What does it feel like? What are you doing? Rather than brushing your teeth and thinking about, something you have to do on the computer, your email last night, I got that John, what a jerk he is, and all those other thoughts that come. Just stay with brushing your teeth. Very simple. It can be very beautiful, though.
Yes, very much so. That's probably something I should consider later on this evening, what it feels like to actually brush my teeth. That all being said, our time has absolutely just zoomed past us. And before we officially wrap up, I just want to put it out there, do you have any sort of parting, closing thoughts you'd like to pass along to our viewers today?
Well, first, I highly recommend to anybody that they take the steps to start a real mindfulness practice, a formal practice. I'm always available to help anyone, who wants to talk about it. I give the classes at Roswell. I think that mindfulness for patients can be enormously helpful. And it can, especially when we're confronted with our own mortality. That is the most difficult thing that we're going to face. And many people who come to Roswell are dealing just with that. And they need help more than just people talking to them. They need help for themselves inside to learn to love themselves and also to watch what's happening.
Thank you for all of that. And I think so many of us, and some of, I'm sure, our patients who are tuning in, and maybe even some of our staffers too, are going to look forward to the day when we can get back on campus and hopefully maybe attend a class with you as well. So Joe, thank you again so much for taking time out of your day to spend with us for this webinar. And then also thank you to all of our attendees again for spending a little bit of time, if this is right around your lunch hour, to watch our webinar. Now, if any of your questions were not answered, of course, we encourage you to reach out to your care team, but also tune into future webinars as we continue to address even more topics and questions as the weeks move forward. We also do consistently update our COVID-19 page on the website. Additional FAQs are there. You can always check that out at roswellpark.org/coronavirus. And also got to add that the videos from today is going to be available to view on demand, and a link will also be sent to your email. Please stay tuned to roswellpark.org/patient webinars, and also your email to register for upcoming webinars, which again, offered every Friday for the foreseeable future. That all being said, have a wonderful day, everyone. Happy Friday. Have a good weekend. And thank you again for tuning in. Bye, all.